session. Our first guest is Mr. Dr. Benjamin Seibt. I'm glad to have him here. He's probably one of the friendliest persons I've ever met. I can truly say that. Yeah, lots of people asked me this morning to talk to him, so I believe you've got lots of interested listeners. Please go ahead.
Thank you very much for the kind introduction. Thank you. So, my name is Dr. Benjamin Seibt, and I'm a scientist and CEO of Dr. Seibt Genomics. And today I would like to present you DNA tests as key to the modern medicine. So, here you can see the company. It's based in Germany, in Bonn, located at the Rhine River. And our portfolio is very interesting and innovative. It's called pharmacogenomics. I will explain later what it is. Predictive genetic testing, nutrigenomics, and we also offer whole genome sequencing. So we analyze the whole DNA. And nutrigenomics, we analyze things like lactose intolerance, gluten intolerance, things you might have heard. Predictive gene testing is about thrombosis, the genetic risk for develop thrombosis, Alzheimer's disease, or even cancer. And pharmacogenomics is the newest field, and I would like to explain it. The challenge is that drugs don't work as they should, and I can say this as pharmacist. A standard dosage can have no effect for one person or a toxic effect for the other person. And this is the challenge. So the aim is to analyze the DNA for individual therapy. And so that we have the optimal drug dose, no ineffective drugs, no toxic side effects, and this improves the quality of life and also reduce the costs. So how to explain? Imagine we are a group of patients and we all have the same disease and we get all the same diagnosis and the same therapy. But do we all have the same effect and the therapy success? You know it already. It's not like that. And the reason is the DNA. So for some people, we have no mutation in the DNA. The mutation stands for different enzymes. So, for example, the cytochrome P450 enzymes, CYP2D6. And when you take a drug, for example, a prodrug, which doesn't work in your body, you need first the enzyme to metabolize it in your body, that you have the drug in the end. Then you have the normal concentration, and then it works. Then everything is fine. But if you have a SNP, which is called single nucleotide polymorphism, then it's possible that the enzyme does not work as it should. So then it's maybe a little bit slower. And this is called intermediate metabolism. And then we have a too low concentration of the drug, and we don't have the effect we want. The same is when we have slow metabolism, then we have no effect at all, or we can have another SNP and then we are a fast metabolizer. And in the end, we have a too high concentration and the side effects. So, so we can test the DNA, and now you're maybe interested in to see how many people have this mutation. And here you can clearly see half of the population, so maybe half of the audience, has no mutation, everything is fine, but the other half is intermediate, slow, or fast metabolizer, so they don't have the effect we want. And you cannot see, so just by seeing the patient, who is a fast metabolizer, who is a slow metabolizer. So we have to analyze it. I want to give you one example. In the field of breast cancer, in India and also in Germany, tamoxifen is the choice, the drug of the first choice. And at the moment, when we have a breast cancer patient, they get tamoxifen, the drug, a prodrug, and half of the women have therapy success and the other half not. So the chance that they develop breast cancer again is really high. With our therapy, we do DNA analysis and adjust individually the dose of the drug. And then we have the therapy success. And so, therapy success, we don't have trial and error to find the right dosage. Patient and therapist knew from the beginning which is the right, that we have the right dosage, and we avoid seriously side effects, and we have more quality of life. I would like to show how it works. We have developed a kit, the Dr. Seib Genomics kit, and we don't need blood. We only need saliva. So with this buccal swab, we get the DNA from the patient, and we can send this kit to India. You take the saliva, and then send it back to Germany. We analyze everything and send you the result. So it's really easy done. Our portfolio, as I mentioned, lactose, fructose intolerance, thrombosis, inherited disease, Alzheimer, cancer, pharmacogenomics. We have many different drugs in oncology and also in antidepressant drugs and many more things. I'm here because I'm searching for a good Indian partner. So I'm searching for you, someone who is good in sales, has contact to clinics, physicians, pharmacy, to open the market for these innovative tests. And so basically I'm searching for a competent, reliable, trustful Indian partner with good contacts to clinics, physicians and pharmacists to offer these genetic tests from Dr. Seib Genomics here in India. And thank you very much. I hope you enjoyed it, and you can contact me and we can talk about it. Thank you.
Thank you very much. That was very interesting. Do you have any questions from the audience at this stage? Yeah, that was the first question.